welcome, welcome, welcome to Health Issues. I'm your host, Chris Sylvain, and thoroughly excited about today's show. Totally overjoyed. In light of the Hobby Lobby decision, the Supreme Court decision dealing with contraceptives, we thought it would be necessary to delve into this concept of contraception. How does it work? It seems as though the news media and everybody else talks about how these products work, but I think we need to speak to those who know how they work. Anyway, we have two great guests for you. You have Dr. Syreeta Tilghman, Assistant Professor of Pharmacology at Xavier University's College of Pharmacy, and we also have Dr. Heather Urrego. She's Assistant Professor of Obstetrics and Gynecology at Tulane, at Tulane University, and we're excited to have them both. Welcome.
Thank you.
Oh, really, really. Well, let's jump right into it. Dr. Urrego, let's talk about contraception in and of itself. What is contraception, and why is it an issue?
Well, contraception obviously is to prevent pregnancy, but it has lots of other purposes. It can be used for painful periods, heavy periods, but what we're talking about today is just for the prevention of pregnancy. And there are actually several ways that we can prevent pregnancy. Of course, number one, you cannot have sex, right? But we've proven that that doesn't work as well as we would like. So this is a model. It shows the different parts of the reproductive tract. Basically, we have the cervix, the uterus, and the uterus wraps around the fallopian tubes and the ovaries. Mm-hmm. So what you can do, so aside from not having sex, nothing entering the vaginal canal, you can thicken the mucus around the cervix so that the sperm can't penetrate. You can make the lining of the uterus inhabitable to the ovum. You can transect the fallopian tube or make it to where nothing can pass. That would be a tubal ligation. Or you can stop the ovary from ovulating. So this is basically the tract. The ovary has to ovulate, the egg is released, travels down the fallopian tube, which is where the sperm will meet up with it. It enters into the uterine canal, or here, and implants. So you can inhibit any of those areas, and we have different drugs and different implants that work along those paths to prevent pregnancy. We have about 10 different methods or so. The combined oral contraceptives, anything with estrogen and progesterone, I'm sure you can get into this a little bit more, is actually going to stop the egg from being released. We have tubal ligations that just block the transport. Then we have IUDs, which actually sit inside the uterus and actually thicken the cervical mucus and do create a hostile environment so the egg doesn't implant, and that's where we can get into more discussion later. Also, it can slow down the sperm transport through the mucus into the egg and affects the sperm quality as well. So that's contraception in the big picture.
Contraception 101.
Exactly.
All right, we got an A. I got an A. Okay, good deal. Now, what amazes me most of all is that the Supreme Court, man, did these guys know all of that when they were doing the decision? You know, that's the first thing I started thinking about. And you know, because you're dealing with drugs, you're dealing with complex issues, and there's so many different ways that work. Dr. Tilghman, let's look at these drugs. Let's talk about the issue and the controversy.
So the controversy regarding the Hobby Lobby case is they are restricting the Affordable Care Act from covering specifically two types of contraceptions. Emergency contraception, of which there are two that they're restricting, Plan B and Ella, and essentially they are progestin only containing contraceptives, which, as you described, pretty much create this hostile environment and inhibit sperm motility and thickening the mucus in the cervix to inhibit the sperm from reaching the ovum. Whereas the others that they are restricting are the IUD, or the intrauterine devices. They're two types. One is a copper-containing IUD, which must be surgically implanted, and it basically releases a synthetic form of progesterone, as well as Mirena, or the copper one just releases copper, which kind of inhibits the sperm, and the other, Mirena, it inhibits or it releases progesterone, and basically kind of has the same mechanism of interaction by inhibiting motility of the sperm, thickening of cervical mucus, and basically inhibiting implantation from occurring.
Okay. So, but why they pick those? That's the thing I start wondering.
So the reason we're thinking that they chose those is because of how they affect ovulation. Okay. So we're thinking that that's basically the reason why they chose those. I think you can kind of elaborate more on that.
Right. Well, you know, it depends on, we get back to the discussion about where life begins. So the main argument in the Hobby Lobby case is that they believe that these 4 drugs are somehow abortifactants, causing the loss of a pregnancy. So using their definition, the strictest definition, life begins when an egg is fertilized.
Right.
So if you're using a type of contraception where an egg is released and the sperm could possibly get to the egg and fertilize the egg, and then the egg can't implant, then that's an abortion. Okay. Most medical professionals would agree that life does not start until the egg is actually implanted into the uterus. So that's the difference. That being said, something like a copper IUD or a Mirena causes, they guesstimate that approximately 1% of eggs that are implanted, or that are fertilized rather, wouldn't implant, which is about a normal person who is on any type of contraception, about 1% of fertilized eggs won't implant. So is it really an abortifactant? Is it really just, you know, nature's course? Who knows?
Who knows? But the other, somebody was mentioned that this Supreme Court was wonderful for men, but challenging for women.
So it is very challenging for women, because when you see a landmark case like Hobby Lobby and how restrictive they are with providing coverage for those 2 types of contraceptions, in my mind, not abortifactions, is that how will this extend to other types of contraceptions or other types of medications for employees working under these conditions? For example, I attended a seminar a while ago where we were looking at health disparities, and there was a Muslim student who presented and discussed how certain medications were prohibited because they were gelatin-coated tablets, and they couldn't actually take them because gelatin is made from pigs and they don't eat pork. And so if you have a company who has that belief, they then can, you know, impinge that upon all of their employees. And how many medications will be blocked out because of an employer's decision on their religious belief? And so I'm just concerned as to how that will extend. And yes, that is effective. Initially, we're looking at it for contraceptive in women and how that enraged a lot of women, but I think men should be concerned as well, because that can extend to many other avenues.
And not only that, it affects, you know, if it's a man who's employed at one of these closely held companies, it affects his wife, it affects his daughters, everyone else covered under his insurance. And something else I think about, you know, about how it's going to affect women's health care is, first of all, it's my belief that the decision on what medication should be used should be made between a patient and her physician.
Good point. And
there are very good indications to not use a hormone-containing contraception in certain women. Like even a Mirena, which is an IUD, secretes progesterone, about half the time will stop ovulation. You can't use that in women who have had progesterone receptor positive breast cancer. We often don't use it in people who have had clots in their legs called deep vein thrombosis, or clots in their lungs. So by them saying we won't pay for you having a copper IUD, well, what about these women? So these people are completely left out in the dark. So yeah, that's my concern. There are some things that I don't know if this court considered in their decision.
Well, I mean, but as we can see, the science behind it is pretty complex. It's not simple things. I mean, there's no part of the drugs or the physiology of the woman that the average person goes around popping around in their head all day long.
Right, right.
Okay. The issue, though, of this abortifacients, all right, causes an abortion. If somebody believes that that product, not the product, the baby or the embryo, yeah, I'm confused, okay. All right, but if it's a baby when the sperm meets the egg, all right, it's different than if it's a baby when the sperm has met the egg and the resultant embryo.
Mm-hmm.
All right, travels a week, all right, 6 to 8 days or whatever, then implants. Let's talk about that a little bit.
So essentially your question is, when does life begin? Is the fertilized egg life, or is the implanted embryo life? And it can be one of an ethical question. It could be a scientific question. If you want to actually prove something like that in a lab, you first, must ask yourself exactly what is life inside the lab, in a test tube. Can a fertilized egg, without the environment of the endometrium, sustain itself? Can it propagate? Can it divide? Can it sustain its own life? Or does it require the environment of the endometrium with the nutrients, with all of the proteins that it's absorbing? Does that consist of life? That's the big question.
I don't know.
Right. And I think as we were talking earlier, you can ask 100 different people, they'll say 100 different things. Some people say, as you noted, it's when the egg is fertilized, it's when the egg's implanted, it's when it has a heartbeat, it's when it's 24 weeks and actually can live outside of the mother, when it's considered a viable pregnancy. So I think you have as many answers to that question as you would desire.
Okay then, so, all right, we have the embryo, 7 days. It says once it implants, things change. And realistically, I think nobody can dispute the fact that there are changes in the embryo. But then again, as time goes on, there are still drugs that can work after implantation also.
Right.
So you can still, we'd have to decide, and it would be, I guess, a decision whether that's an abortion or not, even if after that point, if a drug worked to end a pregnancy, mm-hmm. or no, better yet, do we call it a pregnancy prior to implantation?
Right. I think most medical professionals, I can never speak for all, but I think most medical professionals, especially OBGYNs, would argue that you're not disrupting a pregnancy until it's fertilized. Now, once the egg has fertilized, then it is an abortifactant, and whether you believe in that or not is a completely different show. But I would think most people would say once you have an implanted pregnancy in the uterus, it would be an abortion after that. Okay,
and back to the drugs. So there's controversy now on just the regular run-of-the-mill birth control pill. And whether, let's kind of deal with that, whether it can possibly end a pregnancy after conception has occurred.
So that is a controversial question. We do have drugs that are specifically designed as abortifacients, stuff like mifepristone or the former RU-486, which they're basically progesterone receptor antagonists and glucocorticoid receptor antagonists, which will go in and basically block the receptor and stop the release of progesterone, which is commonly released during high levels during the first trimester. Okay. Whereas with a normal oral contraceptive pill, the doses of the combination pill, which will have estrogen and progesterone, the doses are very low. Now, they're not indicated during pregnancy, and I'm not sure what the data is in terms of it causing birth defects, but they're not approved and they're typically not used. But in high enough doses, if taken at the right time, they can act as contraceptions to inhibit a fertilized egg. It's not intended for that use. That's not the indication, but that could occur. I mean, you're basically, with all oral contraceptives, you're really trying to trick the body into thinking that it's pregnant. So it's basically you're altering these cyclical hormones in the body. And so in the right doses at the right time, you know, a lot of things could act to alter pregnancy.
Right, and most people agree that the oral contraceptives are going to inhibit ovulation. That's the primary mechanism of action.
Got it.
And they do not usually, if you are pregnant and taking birth control pills, it will not end a pregnancy.
Okay.
You will continue to take them and you will continue to grow a normal pregnancy. But as she stated, because most birth controls, it's a simple Google search away from finding out how much of each one you need to take to use it as a Plan B pill. So most can be used in that fashion.
And it can be, but just say like the regular, you know, woman taking it the regular old 7 days, 21 days, and 7 day of the sugar pill or whatever, or however way it works. But in the patient package inserts, or in the FDA, I guess it's the FDA that forces companies to print this literature of how the drug works. Every drug has a mechanism of action, and 80% of them say this is what we think happens, but we're not 100% sure or whatever. But still, in this particular case, the three mechanisms. One, it works at inhibiting, or you guys do it, inhibiting ovulation.
Ovulation, implantation, and well, for the movement of the sperm, thickening cervical mucus, basically, like she said, in creating this hostile environment so that fertilization doesn't occur, and if it does, then blocking implantation.
But and there we go, blocking implantation.
Right.
That's the big one.
Right.
Because then, if these packages are so true, and people believe that life begins at conception, then that person, ethically, morally, or whatever, if that's what they really believe, they can't use the pill.
Oh, you're absolutely right. I think that the most strict Catholic archbishops would probably say that there is no form that is 100%.
Okay.
But that being said, if you use an oral contraceptive strictly as directed, your risk of ovulation is probably less than 0.5%. But they have to, when they're doing this package insert, they have to think about what is perfect use and what is actual use.
Okay.
Right? So if you miss a couple of pills at the right time of the month, there is a good chance that you might have an ovulation.
Okay.
And so yeah, that's the world we live in, right? Nobody's perfect.
Which is true, but say for somebody that believes, I mean, I always think about the guys out there shooting abortion doctors, you know what I mean? And so this is strict dogma. I will never, if I believe that's a child, I believe, you were speaking about it earlier, that we believe that this is a child, so therefore my wife will never ever run the risk, even if it's 0.0001% of using a product that can do that. And right now, I guess what you guys are saying, we really don't know.
We know that with perfect use, you are very likely 0.001% to ovulate and for it to be an abortifactant, regular oral contraceptive pills. But exactly, there's no guarantee, because there's no guarantee that somebody's going to use the contraception appropriately. That's why the long-acting reversible contraceptives, the Mirena IUD, the copper IUD are so much better, because you don't have to depend on anybody to use it as they're supposed to.
Right, and not only compliance, cost.
Right.
You know, they're a lot cheaper. You know, something like Mirena can provide contraception for up to 5 years.
Right.
So you're going to have, it's surgically implanted, you're going to have 100% compliance. Whereas if you're depending on someone to take a pill every day, that may or may not happen.
Not to mention, some of those pills can be quite expensive. You mentioned costs, and that's something, you know, with a Affordable Care Act, put the contraceptive coverage into the bill, because cost is such an inhibition to women using contraception. They are expensive. The Mirena, the Paragard, the whatever you want to talk about, they're a huge cost up front, up to $1,000. But that's over 5 years, right? Or the Paragard over 10 years. So with a birth control pill, every month they have to go to the pharmacy and pay $50, $80, depending on what their copay is. So yeah, cost is a huge reason that people are non-compliant with their contraception, especially contraceptive pills.
That brings us back to the Hobby Lobby decision. So if a company decides that they believe we don't want our employees, even if it's 0.0001% chance to have use a product that can actually cause an abortion, then if they have 10,000 employees and 10,000 employees or would hope that somebody else would have to pick up the tab for those products. I think the interesting thing about the Hobby Lobby issue, though, is that they pick only certain products that has a higher chance of abortifacients, am I correct? But not eliminate the chance. So from when we move it out the science part to the ethically moral part, if that's what somebody believes, it's almost arbitrary for them to just pick those pills or those devices.
Yeah.
I think as far as that goes, they pick the IUDs, and the copper IUD is a known abortifactant. I mean, that's something that can be used as what we called emergency contraception.
Low-hanging fruit.
Exactly, that's exactly. The Mirena IUD, like as I mentioned earlier, 50% of the time women are not going to ovulate on the Mirena IUD. Its primary method of action is going to be the thickening of the cervical mucus, changing of the sperm, slowing its track down, and then the morning after pills. You know, there was a lot of data at some point talking about how they change the endometrial lining. But what they do is they actually give the women these pills, the Plan B pills, then they bring them back, and we have methods to sample the endometrium. So they sample the endometrium, and more recent data has said, you know what, it's not working by changing the endometrium. It's actually working by inhibiting ovulation. So then that argument doesn't really hold water either.
Well, help me out on that. Let's go back to that one, because I'm curious about that. Okay. All right. Sex has occurred. That we know.
Yes.
that we're sure about.
Right,
okay.
Right.
We're sure about that. All right. They take the pill within 3 days after. Okay.
Right.
But ovulation hadn't occurred.
You hope. If it has, remember, if it has occurred, then we're counting on the secondary mechanisms that'll slow the movement through the uterus of the sperm through the uterus to the tube where it's going to meet up with the egg. You hope they haven't ovulated.
But I figured the guy got there by 3 days, huh?
Remember, it's a couple of day track. They can live for a long time.
Yeah.
Well, but all right, I'm still confused. I mean, that's just the point. I mean, okay, so, but all right. So there's controversy, though. Right. We don't know.
Right. There's definitely more research that could and should be done.
All right. And like Tim, you had mentioned earlier that to solve this, we need big gun study.
We need big gun studies from the NIH, really, to try to organize to really answer the question of when does life begin, a very large clinical trial. The problem with that is money. You know, does the NIH want to invest this type of money in answering a question that may not necessarily turn into profitable dollars? You know, so we do the experiments, we get this huge trial going, we recruit all these women, we do all these studies, and one way or the other, you know, depending upon what we find out, what does that really mean for, it's all about making money, you know, and the other thing is, how is that going to affect all these pharmaceutical companies? So if we find out that real life begins at fertilization, and if we have people who then believe that, okay, well, this is where life really begins, and someone who is pro-life, then that's going to affect how a lot of people view contraception.
And the drugs themselves.
And the drugs themselves. So will pharmaceutical companies take a huge hit when, you know, you have a population that now has scientific evidence that proves, okay, well, fertilization is life. So how does that affect their pockets?
Yeah, and then again, and we still have people's own moral, ethical beliefs that,
right,
regardless of what
science says,
science says, they can see.
And then if you do the science, and you know, what is that one experiment that shows fertilization is life? How do you prove that in a lab? I mean, I have my ideas on how to prove that, but we may not all agree that what I interpret as life is the same as what someone else interprets as life.
And even how the drugs work, though.
Right.
And they're actual, to move from 0.0001% to where we get to some real solid, hey, this. Now, another question. Is it even possible to know that deep of, is implantation occurring? I mean, is the drug, that embryo, the mechanism of action, that it just inhibited implantation? Will we ever know 100% that the mechanism of action of
I don't know that we will know 100% unless we invest the dollars to actually do the studies. I think that
we could, though.
We could, but I think that everyone is satisfied enough with, well, they work. So why do we need to keep figuring out exactly how? They've been around, they're effective at 99%, so why do we need to keep investing dollars in a mechanism of action that it may not be exact, but the outcome is good, very low side effects, they're effective?
I think it's probably one of the biggest decisions, because to move from 2.1 kids to 15 kids.
I mean, there's so many issues to think about when it comes to that. First of all, the cost, cost to society. I mean, the complexity that goes through my mind is that, you know, society apparently doesn't want to pay for contraception, but they don't want you to get an abortion. But when the kids are born, you're not allowed to take from society to pay for anything. So, I mean, it's a very complex picture in my head. But aside from that, having 15 kids, the cost to society, to the parents, the safety, having back-to-back pregnancies increases morbidity and mortality, or basically, you know, risk to life of both the baby and the mother. So the risk to life by being pregnant so many times. So, I mean, birth control is, not to mention women who don't need to get pregnant.
Huge health issues. Chris, Sylvain, Dr. Urrego, and Dr. Tilghman, we appreciate it. Tulane and Xavier. These are big issues, and for the right to life folk, study the science. Folk on the left, freedom of choice, study the science, listen to the experts, because these are big issues, and I bet nobody on the Supreme Court ever looked at any of that research. Have a good day. Thank you so much. Appreciate it.